Liver fluke in sheep and cattle. Liver fluke is a trematode parasite that feeds on bile and blood in the liver of predominantly sheep and cattle, and also deer on our farms. Now the little liver fluke here, which you can see near the knife and my thumb, gives you an idea of the size of it. Sort of pointy a little bit at one end and a flat, a bit like a flounder. Now this liver is quite severely damaged. See by the white markings on it. This damage has been caused by chronic liver fluke. The liver fluke that infect the sheep are the same ones that infect the cattle and the deer. And in this U here, we've got signs of what you consider to be facial eczema. You've got photosensitivity, loss of wool around the head. That is caused by liver fluke damage. Now we'll see that in sheep and cattle. You don't see that sort of disease. In cattle, the issue is more a chronic loss of production. In this video here, we can see some liver flukes in the liver of a sheep. Now this is a very heavy infection, and we see this in sheep sometimes, but don't see it in cattle. So you can see them wriggling away there. So they're, yeah, funny looking little parasite. So in the life cycle, you've got two stages. You've got the end host, which is the sheep, cattle, the deer, the rabbits, and in those, the liver flukes live in the bile ducts of the liver. They're feeding on blood and bile, and they cause quite a bit of irritation when they're there. They lay eggs. Now they don't need to mate with anyone else. They can lay eggs all by themselves, and they can be up to 25,000 eggs per day. So you can quite rapidly cause infection on a farm. The eggs are passed in the feces, and this little merocydium stage hatches out of the feces after 2 to 4 weeks. And if it can get near water, it swims around trying to find the little mud snail. It burrows into the foot of the mud snail, and while inside it, it goes through another multiplication phase. So the merocydium become lots of little things called redia. The redia then exit the snail as cercariae. They swim along till they find a bit of grass, lose their tail, they encyst, and there's those little metacercarial cysts that are on the grass are what the animal eats. They become infected. Those metacercariae then develop within the intestines, burrow across the abdominal cavity of the liver, get to the liver and burrow through the liver tissue or munch their way through it, trying to get to the bile duct. That's when they do most of their damage. It's that immature stage, burrowing through the liver tissue, that causes most of the damage. Now, interesting to note that, yes, the 25,000 eggs per day per fluke, but also one merocydium here can become up to 4,000 metacercariae. So we've got two stages of the life cycle where you can actually get quite a large multiplication phase. Now, what do frosts do? Frosts and droughts make the snail hibernate or estivate. Okay, so it basically shuts down. Well, it also shuts down the development of the fluke life cycle within it. Once the conditions are warm and wet enough and the snails are come back to life, that life cycle starts up again as well. So frosts stop the snail development, but they don't greatly impact on those metacercariae. They still remain infective in the pasture, so fluky paddocks do remain fluky. Over the period of the winter, those metacercariae do die off, but don't think that the first frost has suddenly removed the liver fluke risk. These are the limnaeid snail intermediate hosts, so a very important stage of the life cycle. See, they're quite small, pointy end. There's Limnaea columella is smaller, and when you hold them up, these snails, the opening is to the left, which is an important way of identifying them because most other snails, it goes out to the right. How do we know if our animals are infected? Works surveillance. So you need to determine what it means, whether it means there's live fluke being seen or the damage from liver fluke. And take care because this may be mistaken with facial eczema damage. Blood samples can be taken from individual animals, which help give an indication of the antibody level, but not necessarily the number of flukes in them. We can do fecal egg counts. Now, it takes 10 to 12 weeks after infection for the liver fluke to mature and start laying eggs. So it misses the immature infection, just like our normal fecal egg counting does, and it may miss low burdens. So if you see eggs in the feces, it means that there are plenty of fluke there. There's a bulk milk tank ELISA. This helps to determine the percentage of the herd that's infected. This is 430 cows or 430 herds supplying Westland Milk Co-op on the west coast of the South Island, and also some herds on Canterbury. So this study here, we got bulk milk samples from the cows in the autumn and ran a test on them to show what percentage of animals in the herd are likely to have infection, going from 0 in the green right up to the red, where up here you have about 100% infected. And at about that 150 level, where it goes from that orangey level, that means more than 50% of the cows in the herd are infected. So we look up here at Karamea, a lot of Fluke, but a couple of herds that are very low. The Grey Valley, most of the herds don't have any infection at all, or if it is, it's at a very low level. Whereas in around Hokitika here, there's quite a bit of infection. So as you can see, the disease is more regionally important, and farmers can use this information to help them decide whether to treat or not. So why would they treat? Well, liver fluke has production impacts. We see severe infection in sheep, but don't really see it in cattle. So the cattle disease is usually subclinical, but the impacts are insidious, as in they're happening all the time. The production loss is due to damage to the liver. So we can see from overseas studies, a milk production decrease of 3 to 6%, reduced growth rates of 9 to 16%, and a large study that was done in Scotland showed it took 10 days longer for cattle to reach 345 kilogram carcass weight if they had liver fluke infection. And cattle that had a severely damaged liver, a lot of fibrosis, took 78 days longer to reach that carcass weight. So that means the farmers spend a lot more feed and animals spend a lot more time on farm to try and reach the same weights. There are also some other studies showing hormonal changes impacted puberty in heifers. These are some pictures of some typical fluke habitats, those boggy areas. This is a mud snail. It doesn't like flowing water, it just likes mud. So we're going to treat these fluke. Triclobendazole is our main drug that's been used for most years because it kills the early immature fluke. Products that include these are switch fluke, which is one sold through the vets, which is a general wormer and kills liver fluke. Withholding periods can be quite long. Fluke Care, you see, is a product that we sell. Has got oxybenzone and triclobendazole. That gives us some synergistic impact against fluke. It's for sheep and cattle. It really is a liver fluke specific drench. Okay, shorter withholding periods than the switch fluke. Fazanex 24 is just straight triclobendazole in a concentrated form to be a lower oral dose for cattle. This product is going out of production. Oral flukicides, again, Closantel. So Clomax, which the other product would be Genesis Ultra in the veterinary market. So Clomax is abamectin plus Closantel in the sodium salt. This is treatment and control of liver fluke in sheep, adult fluke. Now this really is a drench that has got persistent activity against Barber's poleworm. Now, because the Closantel hangs around, maybe it can kill liver fluke for longer. I can't find any data to support that, but it's something to be worth checking. Some quite long meat withholding periods, so to be aware of that, but this could be a good option for drenching ewes in the winter. Q-Drench. This is another product it's a triple drench with Closantel with a lower concentration and a different form of the salt, Closantel salt in there. It's for treating immature flukes. Really, this is a Barber's pole drench, but it has got liver fluke activity. When you look at, I'm talking about early immature, and mature or adult flukes. What am I meaning? Is that after the Metacariae get eaten by the animal, those early immature flukes are going through the peritoneal cavity, they get to the liver, they start eating their way through the liver to get to the bile ducts. They're very difficult to kill in these early immature and immature stages. Much easier to kill once they're in the bile ducts. So Fazanex, triclobendazole, kills all stages of fluke. Closantel can kill adults. So from that 8 weeks after infection onwards. Was albendazole in the oral drench, really only kills adult fluke, the 12-week-old fluke in sheep. We have injectable flukicides for cattle. Anemic Super, it's got Ivomec and Clausulon, so it treats adult fluke and will be used as a general wormer. So it's quite a good option for dosing cattle in the winter or into the spring to remove the adult flukes. Nitromac injection through the vets is a very good treatment that it can kill early immature flukes as well. So it's got a broader spectrum of fluke kill, a longer withholding period, and cannot be used in dairy animals of any sort. So you can't use it in any animal that may produce milk for human consumption. Poron flukicides, Genesis Ultra, so for us, Sidectin plus Fluke. Yes, so these are a general wormer and triclobendazole as a poron. They're a convenient way of treating them, but not as effective as an oral product. So triclobendazole needs to be at a high concentration to kill fluke, so the porons are less effective, particularly in populations where we're seeing triclobendazole resistance. Now, this is a study here by Verback in Australia showed that the percentage reduction of 2-week-old fluke, so very early infection with fluke, very early immature flukes, 100% kill with flucazole, which is Fluke Care, you see, for us. So good kill there. In that same in those same mob, using the poron of triclobendazole plus abamectin, so like Genesis Ultra, only gave a 15% kill. So you can see a significant difference there, but if the farmer wasn't checking, they necessarily wouldn't know that. Get the question about oxybenzone and albendazole in oral drenches and which is better at killing fluke. So if I look at the labels, Oxven C and Bomatac, both have oxybenzone at 90.6 grams per litre, and aid in the control of liver fluke in sheep, only in sheep, and it's adults only. You read further down the label. Interestingly, a product like Matrix Hyman has got oxybenzone at the same dose rate when you convert it, but it doesn't have any claims against fluke. So same product, same concentration, different claims. Arrest high mineral albendazole. So it provides its control of adult liver fluke in sheep on the label, and going on the website it says it provides some added control. Now for ACVM to get efficacy against liver fluke in New Zealand, you must kill more than 90 or equal to 90%. In summary, both albendazole and oxybenzone are able to kill a percentage of adult liver fluke at a higher dose rate, not at the normal dose rate we have, but they are unreliable for fluke control. And any label discussion I can find are only about sheep. So looking at the cattle products with that early immature, and then mature flukes. This is from Verback in Australia. Looking at it, Nitromac injection can kill down to 2 weeks. Fluke Care oral, kill down to 2 weeks as well. The triclobendazole oral products, just triclobendazole on its own, they had it down to 4-week-old fluke, so pretty good spectrum as well. Anemic Super, like things like Ivomec plus Icon F, already is doing adult flukes, okay? And albendazole, as in this Australian study, that's what the kill they got there. So the Anemic Super injection, good against adult fluke, whereas your Fluke Care is better, gives you a more broad spectrum kill, as would also the Fazinex 24. So in summary, liver fluke's a regional parasite that is seasonally important, which is really reliant upon the snail, the intermediate host, having sufficient water and warmth for it to be able to multiply up and for it to be a healthy fluke to continue the life cycle. Migrating immature fluke cause most damage, and as few as 10 flukes can decrease production in cattle. Sheep are more susceptible. Now, that could be that they've got a smaller liver in relation to a cow, and yet the liver flukes are the same size in them. So 50 flukes in a sheep, you'd think would have a greater impact than 50 flukes in a cow. And sheep don't seem to be able to resist infection, so you can see very high infestations like we saw in that earlier video in sheep. Don't really see those in cattle. But cattle, their livers tend to become more fibrosed. So cattle can remove infection. So flukes seem to live for about a year, maybe a bit longer in cattle, much, much longer in sheep. And cattle have some ability to resist becoming infected. And that may be some thickening of the liver capsule to prevent the fluke from being able to burrow into it. Treatment in the autumn is often done to remove infection before the winter, which I suppose tends to be more when animals go into heavy pregnancy and more stress on them then to take that pressure off the liver. And spring treatments are to prevent pasture contamination with fluke eggs. There is triclobenzol resistance identified in New Zealand, it becoming more of a worldwide issue. I think it's something we need to do more study on New Zealand to find out how effective our products are. And liver fluke is a zoonosis, so we can catch the same fluke as well. I was going to finish up here with a video of a little fluke in a petri dish sucking along. So it has a little oral sucker at the front where it sucks onto the dish, and then by peristalsis, it's moving itself along. So when we look at this, it's still got a bit of food in its pharynx there, and these lines are its digestive tract. So it eats bile and blood, digests it, and then pukes it back out its mouth, and away it goes again. So that is Fasciola hepatica, the liver fluke.